Jonathan Levitt, one of the partners at Levitt, as well as John Morrone, head of our Life Sciences Regulatory Group. Today we're going to be talking briefly about the COVID-19 pandemic and its impact on the healthcare and life sciences industries. John, with many patients staying at home and not visiting doctors and visiting pharmacies, we've heard a lot in the news and from our client base about temporary shutdowns of either a medical practice or a pharmacy. What are some things that these licensed entities should be thinking about?
Notwithstanding the fact that there are government shutdowns, many of these licensees have not received waivers to change their patterns. So for example, physicians, even though their offices need to be shut down, or surgeries, elective surgeries being canceled at hospitals and ambulatory surgery centers, physicians still have a legal obligation for their patients, and sometimes these situations can actually cause the physician to be in violation of patient abandonment rules, plus their ethical obligation to care for these patients. On the pharmacy side, most jurisdictions across the country, pharmacy has to file with the Board of Pharmacy their hours of operation and days of operation. And if there is a curfew that cuts those hours short, the pharmacy can be in violation of state laws. Now we have, in certain jurisdictions like New Jersey, the board has been progressive and has implemented a program where a pharmacy can submit a request for a waiver in the situation where they either have to close down for financial reasons or their hours are cut short because of government restrictions. But the licensee has to actually file with the Board of Pharmacy. It's not an automatic release from their obligations. Similarly, with physicians, they have an ethical and legal obligation to their patients. The fact that a municipality says you can't be open past 8 o'clock at night, or you can't open at all, doesn't alleviate the physician from their obligation. And then, notwithstanding the licensing laws, and you would know this as a litigator, is that physicians and pharmacies could be liable for malpractice if they close their doors and don't deliver prescriptions to patients, or a patient attempts to reach out to a physician and can't get them, or the physician had ordered surgery and now just isn't going to do it. How do the physicians deal with that? And these are topics that really, licensees need help from attorneys to help guide them and keep them compliant, so that when we come out the other side of this COVID-19, they have a viable practice to go back to.
I should also note, with respect to pharmacies, the PBM, Pharmacy Benefit Manager manuals, they have strict rules about some of the things you mentioned, like hours of operation. If you temporarily close down, the PBM knows, they have all your data, they know you're not processing claims, and it would not be beyond PBMs to cancel contracts to hold people in breach for that.